We've all been there, sitting in a stark waiting room, balancing a clipboard on your knee, quickly skimming the bottom of a dense, multi-page medical consent form. You sign your name, confirming you understand the risks and benefits of the medication you're about to take. On average, this entire process takes a patient about 30 seconds. But if you actually wanted to read and comprehend the clinical data behind an antidepressant consent form, those 30 seconds aren't going to cut it. For a medically literate reader, fully parsing the true risks and benefits of these drugs takes between 8 and 9 solid hours. That rapid signature is the entry point to an enormous market. Antidepressants represent a $19 billion annual industry, actively prescribed to an estimated 30 million Americans. Despite that massive scale, neither the patients signing those clipboards nor the doctors handing them out have access to the complete picture of what these drugs actually do. To understand why the medical establishment is operating in the dark, we have to look at the work of clinical psychologist Dr. Irving Kirsch. Using the Freedom of Information Act, a legal tool that forces government agencies to release unreleased documents, he bypassed the curated published literature and demanded the raw clinical trial data for every antidepressant on record. He analyzed all 74 trials. He found that 31% of them were entirely hidden from the public. They were never published, simply because the results didn't make the drug look good. It gets worse. Another 15% of the trials that originally showed negative outcomes were rewritten and republished, so their results appeared positive. This bar chart compares the perceived effectiveness of these drugs against reality. Because of the buried and rewritten data, the published scientific literature artificially inflated the apparent effectiveness of antidepressants by roughly 32%. Prescribing physicians aren't given access to that raw trial data. They base their clinical decisions entirely on the skewed published literature, which means the entire informed consent process in that waiting room is built on an illusion. Let's look at a chart showing the Hamilton Depression Rating Scale. This is the universal standard for measuring antidepressant effectiveness in clinical trials. It runs from 0 to 51, with higher scores indicating more severe depression. If we redline a standard consent form with the unredacted truth, we have to start here. During these clinical trials, patients who were given a placebo, a simple sugar pill with no active ingredients, saw their depression scores drop by an average of 9.6 points. The patients who took the actual pharmaceutical drug saw an incremental benefit of only 1.8 additional points beyond what the sugar pill already achieved. When you break down those numbers, the placebo effect is doing almost all the heavy lifting. It is responsible for approximately 82% of the total observed improvement in these patients. To put that tiny 1.8-point improvement in perspective, the United Kingdom's medical standards strictly require a minimum improvement of 3 points on this exact scale before a treatment is considered clinically significant. The United States has no such threshold. So the foundation of our domestic industry is a drug effect so small, it literally fails to meet international standards for clinical significance. For a drug delivering less than a 2-point benefit, the risks are substantial. Some of the most severe side effects do make it onto the consent form, like an increased risk of suicidal ideation and pervasive sexual dysfunction. But many severe risks are completely omitted. The first is emotional blunting, a condition that strikes an estimated 40 to 60% of patients. While this blunting may effectively numb the lows of depression, it simultaneously strips away the patient's capacity for joy, enthusiasm, and genuine emotional connection. The second hidden risk is discontinuation syndrome. You typically cannot stop taking these medications abruptly. Quitting requires a grueling, medically supervised tapering process that can last for months or even years. That physical dependency carries a severe financial toll too. For some patients, the medical support required to safely taper off the drugs can cost up to $30,000 annually. Trading your full emotional capacity and risking severe physical dependency for a mere 1.8-point benefit radically alters the risk-to-reward calculation, but patients aren't told that. If we move down to the alternative section of our redlined consent form, we can see exactly how that 1.8-point pharmaceutical benefit stacks up against non-drug interventions for mild to moderate depression. This bar chart compares the drug's effect to sleep optimization. A single night of restorative sleep reduces a patient's Hamilton score by roughly 6 points, more than triple the incremental effectiveness of the drug itself. Other evidence-based lifestyle interventions also show powerful effects, including regular aerobic exercise and omega-3 fatty acid supplementation. Even botanical extracts like St. John's wort have a solid body of scientific evidence supporting their use, completely avoiding the harsh physical issues associated with standard prescription antidepressants. And remember that 82% placebo effect. Pharmaceutical companies dismiss it as statistical noise, but it's actually a highly significant testament to the human mind's active capacity to heal itself through expectation, belief, and context. Genuine informed consent requires that patients are told about these cheaper, safer, and often more effective alternatives before a prescription pad is ever pulled out. Look at the checklist on this screen. These are the 4 specific questions every patient must ask their doctor to achieve actual, true informed consent. Ask for the absolute point benefit of the drug over a placebo. Ask about the specific risks of emotional blunting and permanent sexual dysfunction. Demand to know the exact protocol and cost for tapering off. And finally, ensure all evidence-based natural alternatives have been exhausted first. Clinical depression is a deeply serious condition that causes profound suffering, and for certain individuals, these medications do provide meaningful relief. You must never discontinue, reduce, or modify any currently prescribed medication without direct consultation from a qualified physician or mental health professional. But until the medical industry transparently provides the raw trial data and lists the real life-altering risks up front, the dense consent form you sign in that waiting room is functioning to protect a $19 billion industry, not you.